Knock, knock. My name's Jamie. I'm going to be your nurse today. So what I'm going to do today is I'm going to do a complete head to toe assessment. I'm going to go ahead and wash my hands. But before I do that, I'm going to go ahead and pull the privacy. Do you feel safe and comfortable? Great. So now what we're going to do is I'm going to go ahead and wash my hands. And as I'm washing your hands, can you please tell me your full name, date of birth, as well as where you are today, and if you know who the president is. Okay, patient answered everything correctly. So now this is when I'm going to say that the patient is able to, level of consciousness is that they are alert and oriented because they are able to distinguish between person, place, and time. I'm then going to inspect their posture and ensure that they have good posture and good hygiene. Now at this time, I'm going to go ahead and start inspecting the head, ears, eyes, nose, and throat. With that, I'm going to go ahead and inspect the head for any bumps, lesions, normal hair distribution, as well as that there are no parasites noted, and the head is normocephalic. Then I'm going to go ahead and start inspecting the face for sensation. So I'm going to touch the face in several different areas and ask the patient if they can feel it. If they can, that is great because that is cranial nerve 5, and that's the trigeminal. And then I'm going to ask them to raise their eyebrows, smile, and frown. And that's going to be for cranial nerve 7, which is the facial nerve. As long as they're able to do that, that means that those cranial nerves are intact. I'm then going to inspect the external eyes for any redness, any lesions, or any foreign objects. But before I do that, I'm going to inspect that their eyebrows are evenly distributed with their eyes. Eyelashes are evenly distributed and curve outwards. The sclera is white, and there is like no discharge coming from that. So that is going to be cranial nerve 3, and that is the oculomotor. I will then begin to test the extraocular movements by doing the 6 cardinal signs of direction. So I'll have them look at my finger and follow it with just their eyes, moving in all 6 directions. Perfect. And then I'll have them get up, stand 20 feet away from the Snellen chart, have them cover their right eye, read all the lines that they can read down to, then assess the other eye, same way. That is going to be assessing for their cranial nerves 3, 4, and 6. So that's going to be the ocular motor, the trochlear, and the abducens. I'm also going to make sure during that time that I'm also checking for their pupil size. So I'm also going to make sure that when I'm inspecting their cranial nerve 3, the oculomotor, I'm going to assess the eyes for dilation with my pen light. So I'm going to go in each side. Then I'm going to have them also look at a picture on the wall, have them look at it, and then look at my finger to assess for near and far, making sure that they are perla and able to equally accommodate. I will then begin to perform the confrontation test. So that is going to be where I hold fingers in their peripheral vision, where they cover one eye, and they tell me how many fingers I'm holding up in each section. And then we're going to switch and do it for the other side as well. That is going to be the cranial nerve 2, which is the optic nerve. If they're able to do that, that means that optic nerve is also intact. I will then begin to inspect the mouth, make sure that their mouth upon inspection with looking at their lips, it is pink, moist, there is no cracks, no lesions or any bleeding noted. I'm going to have them pull down their bottom lip, check for their gums for any lesions, bleeding, or discharge. I'm also going to look at their teeth to ensure that their teeth are, all of their teeth are there, and that there are no any ongoing dental work or missing teeth noted. At the same time, I'm also going to check their nasal, I'm also going to check their mucosa to ensure that that is pink and moist, as well as look at their tongue to ensure that their tongue is midline, as well as their uvula is pendant shape and midline as well, and that it rises with phonation when saying the word ah. I'm also going to assess the size of their tonsils and to make sure that they are, anywhere between 0 to 4 plus. So 0 is non-existent, and 4 plus meaning that they are, almost touching the uvula. And that is going to be observing and then asking them to also swallow, to make sure that they are able to swallow. So that is going to be the cranial nerves 9, which is the glossopharyngeal, the 10, which is the vagus nerve, and the 12, which is the hypoglossal. And as long as they can do all that, that means that they are all intact. Then I'm going to inspect the nose for any, make sure that the nose is there. It's symmetrical within the face. There is no discharge noted when looking up inside the nasal mucosa, that it is pink and moist. There is no bleeding or discharge coming out, and there is no signs of deviation within the septum. I'm also going to ask them to put their finger on one side of their nostril and then breathe in to the other side as well. And that's going to test for nasal patency bilaterally. I am then going to inspect their ears for any discharge, as well as any extra, what is that word? Cerebrum. Not cerebrum. Cerumen coming out of their ears. So that is going to, as I look upon that, I'm going to inspect both sides. I'm also going to pull on the pinna, push on the trachea, assess for any tenderness. And then I'm going to also check to make sure there's no lesions or foreign objects noted in either ear. And then I'm going to assess for their ears for the rub test. So I'll do something similar to this, ask if they can hear it on both sides. And that is going to be cranial nerve 8, which is going to be the acoustic nerve. As long as they can hear that and pass, that means that that acoustic nerve is intact. I am then going to assess cranial nerve 11, which is going to be where I'm going to be doing the shrug test. I'm going to push down, have them shrug up, push against the head, push against the head, and that is going to test for resistance. And as long and they are able to do that, I am then going to assess for the lymph nodes. The lymph nodes then mean that I'm going to start with the preocular, the post-auricular, the occipital. We have the tonsillar, submandibular, submental, the anterior cervical, posterior cervical, and then the supraclavicular. And upon palpation, make sure there's no tenderness noted on those lymph nodes. I am then going to inspect the shape of their thorax with comparison of the anterior posterior to transverse diameters, and the anterior posterior is less than the transverse. Then going to assess their respiratory rate and rhythm with their accessory muscles to make sure that there's no coughing or anything noted. So I'm going to listen, and I'm going to listen for their breaths and times it by 4. So then it would, let's say, be 16 breaths per minute. I'm then going to inspect their spinal alignment. So I would have them stand up. I would feel down their spine, make sure that their spine is evenly flows downwards, that there's no signs of any scoliosis, kyphosis, or lordosis noted. I will then also begin to percuss the costovertebral angle for any tenderness, and then palpate for the thoracic expansion, where I'll be here. Palpate for the thoracic expansion. And then I will do the palpating for the tactile formitis, which I'll go here with this side of my hand, and then ask them every time I touch them to say the word 99, both anteriorly and posteriorly. I will then make sure that there's any heaves or thrills noted. Then I'll begin auscultating their breath sounds anteriorly. So I'll do it for 8 spots. 8. And then when you're looking at the posterior, you're basically going to go like this. Follow through with the shoulder blades and outwards. Then you're also going to want to also check here in your auxiliary. So it'll be here. and then here. Then from there, I'm then going to palpate the carotid pulses one at a time. And then I will then auscultate each carotid artery with the bell of the stethoscope for any bruits, to see if there's any bruits noted. I will then auscultate the heart sounds. So I will begin with the aortic, which will be, and then the pulmonic, which both are in the second intercostal. Then the Erbs point, which is in the third intercostal space. The tricuspid, which is in the fourth intercostal space. And then the mitral, which is in the fifth intercostal space for the heart sounds. I will then ask the patient to lay down to check the abdominal area in a supine position. And I will then begin inspecting the shape of the abdomen, making sure that it's not distended. I will then begin auscultating all four quadrants of the abdominal area with my stethoscope. Then I will begin to lightly palpate in all four quadrants, and then palpate slightly harder in all four quadrants for any distension or tenderness. And then I will ask them about their bowel movements and their urinary habits. Make sure that they are having no pain or tenderness or problems going to the bathroom, and when their last bowel movement was. I'm then going to begin then inspecting their extremities for any edema, tenderness, temperature, and deformities or lesions. So I'll inspect all four by touching all four areas and looking. Same thing with the legs and going all the way down. Upon that time, I will then go ahead and check for capillary capillary refill for on their fingers and toes. And as long as they refill within 3 seconds or less, we are good with the capillary refills in their fingers and toes. I will then ask them to get up and then walk back to inspect their gait. And then I will have them stand with their arms down by their side, stand up straight with their eyes closed for 20 seconds, and stand perfectly still and assess any swaying from side to side for the Romberg test. As long as there's no swaying from side to side, that means that they have a negative Romberg test. I will then begin assessing range of motion of their neck. So I will have them look up, look down, look to the right, left, and then do a big circular movement with their head. I will then ask them to put their arms out in front of them, up high, outwards, and then behind them, different areas, to assess for their range of motion. And they have a 5 out of 5 range of motion if they're able to do that. I will then assess their strength. So I will hold their hands, ask them to squeeze. Same thing with their legs. I would put pressure on the top of their legs and ask them to push upwards. And same thing with their feet. And then I would also have them pull and push away from me. I will then go ahead and do the deep tendon reflexes. So I would do the patellar, so I would hit here and assess that the knee jerks outwards. I'll then hit on the back of the Achilles and make sure that they're what is that? Reflexes there with their Achilles. Then I'll do their plantar. So I'll go here in this type of a motion and make sure that their toes curl inwards. I will then do the triceps. So I would hit here and let them lay their arm at rest, hit here, and assess for the rebound. Then the brachial, I'll hold here and hit up here and assess for the movement of the brachial. And then the brachioradialis would be here, assessing for movement by hitting up here in this area right here. That is going to assess for the symmetry and strength, as well as in those same areas. I'm also going to test for the pulse in all of those areas as well on both on all 4 extremities, so both arms and legs. Then I'm going to make sure that my patient at the end is back in a comfortable seated position. And I need to make sure before I do that while I was doing all of that, making sure that there was no edema noted as well in their extremities. And then I'll put their bed down, give them back all of their stuff, their call light, all their personal belongings, ask if they're comfortable, if they're safe, if they have any questions or concerns. I'm going to go ahead and pull the privacy back, wash my hand, take off my gloves, wash my hands, and then leave the room.